Well, it's an absolute privilege to be here amongst a huge group of podiatrists. And from a physiotherapy perspective, we always look at your conference every year with absolute envy on the basis of the number of people that you manage to get to the conference. So we look at you with envy. And I'm here today having expressed, first of all, that conflict of interest, being a physiotherapist. And I'll share with you in a moment my other challenge of being a complete advocate of podiatrists, which is the fact that this is my dad. And my dad was the most incredible human. And actually, my dad absolutely was completely dependent upon his podiatrist. He had type 2 diabetes. He took the mystery shopper experience of NHS care to a whole new level. He had bilateral Charcot joints and ended up with a huge amount of care needs. But his only desire was that when he died with 2 legs, because he knew full well that if he did actually go forwards to end up with an amputation, he would not be able to stay at home with my mum. He knew full well that he would not be able to be cared for in his home, and that we would then get into a really challenging environment of understanding how we looked after him towards the end of his life. He had the absolute fortune of being the recipient of the most phenomenal MDT that had a podiatrist by the name of Lorraine Barton in Salisbury, who was the most incredible human, who through 11 years of painstaking podiatry support, working absolutely at the top of her practice and coping with my dad's rather tragic wit and humour, she managed to humour him through 11 years of challenging care to ensure that when he did die with 2 legs. And so if you're looking for an advocate for podiatrists, you have it here. I think you are the most incredible, incredible group of professionals, and my dad owes his life to you, so thank you. And we use the adage, saving lives, saving limbs. Well, on so many occasions, Lorraine saved my dad's life. And so, you know, amazing, thank you. And this quote I stole from Lawrence, and I think this quote sums it up for me. In my clinical career, I was brought up by a podiatrist called Mike Townson from Portsmouth, who spent years painstakingly teaching me the art of what podiatry could offer, not just a person, but a population and the taxpayer. And so I think there's an absolute mission here for us in all aspects of podiatry, for us to make sure that the system fundamentally understands what you bring. Doesn't matter where you work, doesn't matter what you do in podiatry, but the benefit that podiatry offers a population is absolutely second to none. Our challenge together is to make sure that everybody across the system who has any decision-making power understands that, works with it, and ensures that we make sure that podiatry is absolutely in the forefront of service commissioners' minds and in the population that benefit from that service. However, I bring to you a bit of a challenge today, and the challenge is that we have an absolute burning platform here in podiatry at the moment with regards to the workforce. And before anybody switches off and says, oh, don't worry about workforce, not our problem, Health Education England can sort that out, or Scottish systems supporting education can sort that out. It's not anybody else's problem, but our shared problem across the patch. And it is a significant problem. I'm going to present to you just the English data, and to other Three Nation colleagues, I apologise for that, but the Health Education England data only stretches as far as our borders. And not to worry too much about the detail, what we have on the far right is the 2012 NHS workforce data that shows us that we have 3,102 physiotherapists. Oh, girl, goodness me, the ultimate crime. Tweet it, and I'll deny it ever happened. Unless you're filming me, of course, Chair, and then I'm completely lost. But just love me through my failure. So 2012, 3,102 podiatrists in the NHS. In 2017, we had 2,995 podiatrists, despite an increase in the number of podiatrists in the system being trained, being returned to practice. The green box at the top shows you that we had 1,038 new joiners, students who came through full of hope to join their profession and to become the podiatrists that they wish to be. By the time we get to 2017, we've lost them, because we've lost them to 783 people have left under the age of 55, left the NHS to go and do something else instead. How do we keep hold of that 783 people in the NHS delivering service or across the system delivering service. And what was really fascinating earlier in the workshop was to hear podiatry colleagues talk in terms of the fact that actually private practice is really struggling to recruit as well. So the challenge is, where are they going? And why are they going, most importantly? This is a wicked problem. We've got a real storm here, a perfect storm happening. We have got not only a reduction in the workforce, we have got a reduction in the number of 18-year-olds coming through the system. We have no longer got in England the NHS bursary to train these students. And we have got an incredible challenge of children with a huge career choice. And because we haven't got the bursaries any longer, we have lost our mature students. Our universities are vulnerable. A wicked issue. And Keith Grint does some really interesting work around wicked issues and talks in terms of there being tame issues that you can solve quite easily, critical issues that you can actually solve because you get given power because things are time critical and you can do things. And then there's the wicked issue, which are not clear issues, they are challenging issues that we really do need to work through together to create a solution which people will work with and that we can actually deliver a sustainable intervention into the system. This is, beyond doubt, a wicked issue, which means a call to say, bring back the bursary, do this, do that, doesn't work because it's not that simple. Because actually, when you look back over our workforce data, and in December we will have not only this year's data coming through, but also we'll have the aggregate data from UCAS coming in to tell us what the student numbers look like this year. But the challenge we have is that podiatry has been a challenged profession for a long time. And so we do not have any quick fixes here which will work easily. What we have is the need to come together as a profession to really think about how we work differently together, to entice a whole new generation or generations of podiatrists into service. And that requires us to think quite differently, because as professions, we always silo off into different bits. I might do diabetes, I might do musculoskeletal, I might work in the NHS, I might work in the third sector, I might work in private practice. None of that matters in this conversation, because although I've presented to you the NHS workforce data, those podiatrists are your future private practitioners, potentially. Those podiatrists are in the system, regardless of where they work, delivering hugely important service to people and to populations. So the challenge we have is, how do we, as a group, come together to ensure that we take absolute responsibility for the current workforce crisis in all of its forms? And that requires us to put aside previous challenges, to put aside any difference we have about how we work, what we think of each other, and to come together to understand how do we move forwards together to create a real uprising of podiatry, a positive uprising of podiatry. And colleagues in the session earlier again were talking about future nurse. And when you look what the nurses have done, who are a huge, very powerful, very vocal, very valuable component of our workforce, they have an equal challenge and concern about their future workforce and the amount of work they are doing across the profession to enable next generations to see nursing as a career, but also mature students, people leaving the army services, wherever they fall, to think about how they may consider nursing as a career. We need to be in the same place around podiatry, making sure that people understand the amazing job opportunity of podiatry. You are a group who are never going to be out of work, so that's great. You're a group of people who are never going to be taken over by artificial intelligence because Alexa can't sort the problem out. So we've got a job here for life, which children, adults could qualify for and have occupation. Many people do degrees and don't have that joy and that privilege when they graduate. How do we really start to think about how we sell that good news message across our professions? And I think we need to be really clear. There's lots of things that we need to do that actually the NHS really struggles to do. Things like work experience. Every NHS organisation has every single excuse in the book as to why they cannot offer work experience to children. You have to be over 18. You have to be X, Y, or Z to get a place in an NHS organisation. Most people I know who have gone into podiatry as a profession who had work experience got it from a private practitioner colleague in their local community. And so hats off to private practitioners. Thank you so much for what you do to entice the next generation to see the wonder of what you do. But we need more of it. We really need to think about how, as a system together, we can offer not only work experience, and then think about how do we train differently? How do we open up student placements? How do we think about what the apprenticeship opportunities could look like across a system, working together, not in isolation? A challenge, not insurmountable, needs to be thought through, and requires networks to come together in systems to work to be seen. And when you think about in England, in the NHS, we have lots of system transformation happening. We need to be present in those conversations, being heard, being understood for the offer that podiatry brings. But I put it to you that we have a bit of a challenge here to really think about what is the modern story that podiatry tells. We see Australia and South Africa with a really interesting image of podiatry, not challenged to recruit as we are challenged to recruit into our university programs. What is it that we need to be saying in the UK around the image and the identity of podiatry? And I just suggest that it's the conversations that we have in our normal day-to-day life that determines whether or not people want to think about podiatry as a career. You think about the school gate conversation. You go to school gate, oh my goodness, another day, terrible day, nobody appreciates podiatrists, nobody understands us, nobody loves us, every profession does it. I was with the therapeutic radiographers the other day who are having the same challenge, and several said we never introduce ourselves to anybody as a therapeutic radiographer because we then have to explain A, what we are, what we do, and B, we have to hear their journey, their challenges, and their experience of living with and beyond cancer. And actually, when we're out and about, we don't want to do that. But then when they reflect, they realize that was their missed opportunity, potentially, to tell people more about what they do. Because when you think around the dinner table of an evening, your child comes home and says, I've done my A-level choices, really excited, opens lots of career doors for me. And somebody suggested I could be a podiatrist. Heaven forbid anybody would think about that, but hopefully they would absolutely have podiatry on their lips because you will have trained those people to think about podiatry. But then the mother at the table says, oh dear, I wouldn't do that. If you saw Charlie's mum at the school gate, she's a podiatrist, hates her job, terrible, always complaining about the NHS. And suddenly, this little child's aspirations to become the podiatrist that they thought they might want to be have been squashed overnight because mum says no, because she knows people who don't like their jobs. And we were comparing notes earlier about what made us become what we were. And I became a physiotherapist because my mum said, don't whatever you be a nurse. I'm a nurse, exhausting job, don't do that. Be one of those physiotherapy things. They waft in their blue trousers, tend to marry very well. Go be one of those. I thought, fantastic, I'll go be one of those. Brilliant idea, thank you very much. So she managed to put me off the scent of nursing, but then moved me to another profession. So what are the stories that we can tell as we go about our day-to-day life to excite people to the fact that actually this is a brilliant job? What an amazing job. What a privilege to be responsible for keeping my dad alive for 11 years with 2 legs. That's incredible. How do we tell those stories to the system? How do we really make sure people think, yeah, podiatry? I would argue that most kids going through school have never heard of a podiatrist, ever. How do we change that? How do we make sure that there is a very, very, very different narrative happening? And there's a scheme at the moment called Inspiring the Future, run by NHS England for the 70th birthday of the NHS. It asks you to give up 1 hour of your year, 1 hour, to go into a school to tell children about your profession. Incredible. What's 1 hour of your year with the thought that maybe when you slip off the edge of the HCPC register when you're grown up, there's somebody coming on behind who actually you were responsible for bringing into the profession. How incredible would that be? And so I'd argue that the next generation of podiatrists is actually all of our responsibility. When I was working as a multi-professional service manager in an acute trust, I had got absolutely no consideration for the thought that I was responsible for the next generation of allied health professionals coming through my services. I did everything in my power to get out of offering work experience because we were so busy we couldn't see where it fitted and the bureaucracy was enormous. Unforgivable in retrospect. We didn't go into schools. I didn't release my students or my newer staff to go off and do visits to schools to say, look at this as a profession, isn't it incredible? Didn't cross my mind. I look back now and think, why did it not cross my mind? Who did I think was going to be doing it? In Health Education England, you've got me. I am not going to get to every school in the country to go tell kids about podiatry. It's just not going to happen. We've got the Office for Students, and we have Alex. Alex isn't going to get to every school in the country to talk about the professions. What is it that we can all do that shares the responsibility for that next generation of podiatrists coming into the profession and then choosing to stay in the profession and have that self-actualizing career? So I put it to you that we actually have an absolute shared responsibility to create careers for all. And I say careers for all because I want to go back to what I said earlier. This is not just about our fabulously valuable 18-year-olds who are coming out of university, who have the opportunity now to train. Where have our mature students gone? We've lost them with the bursary. How do we work together with the apprenticeship opportunities to bring our mature students back? Because actually, when you looked at our demographic profiles of our undergraduate programs, they were very, very highly populated with mature students. So important and such a valuable part of our workforce. How do we get them back? How do we embrace the apprenticeship opportunity together to create careers for all? How do we widen participation by thinking through how do we work with our support workforce to make sure you could come to my organisation as a Band 2, doing a Level 2 apprenticeship. You could take that journey right the way through to being an advanced practitioner or a consultant, through an apprenticeship pathway now, potentially. Why are we not thinking about that, how we cook our own workforce, how we create our own workforce locally based on people who live in our neck of the woods, work in our neck of the woods, and actually are vested in our neck of the woods? What a different loyalty you get in your workforce when you grow people from your local communities. So really think about how do we do this? And the apprenticeship agenda is fantastic, but it brings with it new challenge. It opens up the market. It's referred to as being I get this the right way around, a constructively disruptive innovation in the marketplace. It's designed to mix things up a bit. Fantastic. So it's really important, again, that we work together and we start to really think about what will the NHS apprenticeship opportunity look like? How could we work with our system, with colleagues in other organisations, in NHS commissioned services, in private practice, to really start to think about placements, opportunity, and showing those students the wealth of opportunity within the podiatry profession. So, I'm going backwards, that's exciting. So Belinda spoke earlier in the conference about Mind the Gap, the generational issues. And we have a really interesting challenge in how we keep the generations interested in this job for life. We're told the average person graduating today will stay in their job for 10 years and then think about a change. Goodness me, how exhausting. However, that is the choice that many people are making. So how do we then think about, what does that mean then for people as they go through their careers? How do we then think, actually, rather than we used to worry about, well, I'm not going to train you to be a podiatrist if you're not going to give your entire career to podiatry. This means if I'm going to do a career change every 10 years, it might be that when I am 50, I want to train to be a podiatrist. Brilliant. Think of the life experience you bring to the table to train to be a podiatrist when you are 50. And then you do another 5, 10, 15, 20, whenever we're allowed to retire, years as a podiatrist. We've really got to start thinking about it. Because although the generational gaps are attributed currently to age profiles, what we see really interestingly is the people that are working with and associated with the new generations coming through, their behaviours start to change and morph too, to often mirror those behaviours of our new generations coming through. So some really fascinating challenges for us. And how we really think about portfolio jobs. This is a careers resource that my fellow is creating currently for all the allied health professions to think about the wealth of opportunity. When you train to be a podiatrist, do you realise that you could become a director of public health potentially one day? I didn't know that, but you can. Did you know that as a podiatrist, you could go into any number of different opportunities, routes, different parts, different sectors? There's so much you could do. Everywhere I go in the arm's length bodies in England, Health Education England, Public Health England, wherever, I fall across podiatrists doing other stuff. Brilliant, because it means that they are carrying the voice of podiatry into different parts of the system. But wouldn't it be great if they still had a clinical day somewhere? Wouldn't it be incredible if they still offered clinical service? But in our worlds, often you are prevented from doing that because it's not the done thing. As service managers, as private practitioners, the more that you can do to open up career opportunities so people can continue their clinical careers alongside their whatever else they choose to do careers, that is incredible. The challenge is often in stressed service delivery units, people don't see the opportunities for flexibility for their workforce. How can we really think differently about how we keep people associated with our departments and with our services? Again, how do we get people back? Many people leave the professions to go and do other things. You may take a career break, you might go off and be a carer, have your children, go and do something different, travel, whatever you may do. How do we make it easy for people to come back? We have a whole variety of schemes that we're supposed to do to keep people connected. We're usually quite rubbish at it. We lose people often. They come off the register, and then it becomes an incredibly difficult journey to get back on the register. How do we do that? And currently in England, we have a supported, funded return to practice programme. But we've only had, look at my numbers, 9 inquiries, 5 people sign up, 1 person returned in an 18-month programme. Where are they all? You must know them all. You must have dinner with them. You know where they all are. How are we not getting those people back into, sorry, this is a recruitment drive. No, it's not, honestly. How do we get those people back into service if that's what they want to do? How do we offer them opportunity whereby they could come back onto the register, actually, and they could go back into service and work? Because actually, for many people, as their lives change, they'd like to, but it feels insurmountable. But do you know what the biggest problem we have is that we do have inquiries and we're having to turn people away because we cannot get placements for those people to come back into service to work and to learn their craft. That's so sad. That is really, really a missed opportunity of getting people back into the workforce. And going back into my slide beforehand, in that 5-year period of that workforce data I showed you, there were 32 people who came in from either around and about, back onto the register, or returned to practice. That could be so many more of bringing people back into our professions. Again, doesn't matter where they work, don't mind that. I just want those people back in delivering service. Because when you look at the increase in prevalence of diabetes, the prevalence of musculoskeletal disorders, boy, do we need those people back if podiatry is going to stay a main player in that agenda. And that really is the risk at the moment, that does podiatry stay a main player if we can't recruit people into those roles? We need these people back. But to keep people back, we've got to make the services. We've got to be able to make the case for change. And I share with you, we've done a lot of work around musculoskeletal practitioners in primary care. And again, not to tweet too liberally, but the real challenges that I am tripping over physiotherapists everywhere. They come with their case study data, they've collected it for years, they're quite clear what their impact is to not only the patient presenting to them in a primary care setting, but their ability to reduce downstream referrals into secondary care, their ability to reduce prescribing costs, and their ability to get people back to work quickly. I've got them to a penny. I can't find a podiatrist to help me, to work with me, to show me what a first point of contact podiatrist could look like in film, so I can show the world that actually it's not just about physiotherapy. I have the same problem with osteopathy in that setting, so don't feel lonely with that. But I need somebody, anybody in the audience who works as a first point of contact practitioner in a primary care setting, please grab me at the end, because I need you and I need to film you quickly so that we've got the ability to show that real presence of podiatry in that MSK agenda. I know you're there, I just can't find you. I need you to help me. But I also need you to make the case, because what I then have is people say, well, sorry, I'm going to put a physiotherapist in because all the data's got physiotherapists in it. Brilliant. Often there are podiatrists in that data, I just can't see them. So the challenge for me is help me find the data. The work we did at the beginning of our time working together with the college was to look at amassing the opportunity of economic impact through diabetic care with podiatry front stage in that. That tool has been transformational in helping commissioners really understand the art of the possible of what podiatry can bring. I need the same in MSK, I need the same in the high-risk foot areas so that we can really evidence the impact of podiatry. But that requires us to work together, and many private practitioners are working in private practice, delivering often first point of contact style services where they see people instead of a GP. Brilliant. We need data. We need to know that you make a difference that means that your salary delivers absolute benefit back into that system and to those people. So really interesting to see what we could do to work on getting some of that evidence sorted. So advanced clinical practice, what we're looking to do is working alongside all of the professions, nursing, midwifery, pharmacy, psychology, all the allied health professions, to really be clear that there is a level of practice where you step up and you do really work at the top of your license. Terrible phrase, but it's about really pushing your scope of practice to then prepare to go on to become a consultant role. So we're trying to standardize some training pathways, and we've put the minimum standards forward for the musculoskeletal route, and the college has supported us with that. But also we're looking now at doing the high-risk foot opportunity there, and how we then work with our universities to make sure that there are training programs at master's level that enable people to get a nationally identifiable qualification in dealing with musculoskeletal high-risk foot, which then opens doors for them to be involved in either first point of contact programs in primary care or in the high-risk foot areas. I know many similar things exist already. It's about pulling together what we've got, standardizing it so that we don't throw the baby out with the bathwater. So really important work to understand how we support people to evidence that they are really working at that high level of clinical functioning. We're working with the College of Podiatrists in so many different ways at the moment. I think we are we've got a huge amount of work ongoing. I think we're exhausting them, don't tell them. But I think we've got so much work happening at the moment that we really have got a lot of engagement across the country with podiatrists. What we need is we need more engagement with podiatrists, because actually the only people who change any of the challenges that I've alluded to so far are all of us working in partnership together. So the challenge for us, careers, keeping people in practice, making sure preceptorship works for podiatrists, really working to ensure that we retain the workforce and that we offer self-actualizing careers, we ensure people are trained as leaders, and we ensure that people actually choose to stay in patient-facing roles is absolutely fundamentally important to what we do. But I want to bring us back to the point that we have got a burning platform here. This is not going to go away. There is no chance that we are going to be able to make an impact on this unless we do something really quite profound together. And the most important thing we do is we think about our image, the stories that we tell, how we work together with local communities, with offering opportunities for people to understand what podiatry is, where it offers benefit, and why people might want to think about that as a career at whatever point of their life they are at. It is not going to go away. The risk is it gets worse. That workforce data, I can promise you in December, is going to look worse. And I'm almost too scared to look at the UCAS data, because actually that's going to be a challenge too. We really do need to take action, and that means every single one of us doing something different. And so I really challenge you to think about, what is it that you will do different? Is it that you will sign up to Inspiring the Future and go into that school and offer some time? Is it that you'll make work experience opportunities available to people in your local community so people understand what podiatry does? Is it that if you have a multi-professional leader, you're going to take that person aside for a cup of coffee and a slice of cake and indoctrinate them into what it is to be a podiatrist, what it means, and the messaging that you need them to be carrying for you into those senior meetings and into that executive environment, so that the voice of podiatry is there? What are you going to be doing with your educators to look after, hold them safe, support them, make sure that as a system together you are working to really clearly make the case for podiatry, help those universities absolutely understand that those courses are required in the system, and working ideally with us and with the college to make sure that where there are programs of work that interest you as part of the work we're doing, that you get involved. There'll also be a lot of work around image and identity and understanding what is the story that podiatry wants to tell people about itself in 2018 and onwards into the future. What is it? What is your USP that you want the world to know that actually is a broad enough church so that those working in diabetes feel it matters to them as much as it matters to people who are working within a musculoskeletal environment or beyond? How does that start to come together? What does it look like? But my take-home message is, please, please, please think about your responsibility for the next generation. Think about the day that you put your last HCPC registration in. Will there be podiatrists coming through the system who would not have been a podiatrist if it hadn't been for you, and the impact that you had on their lives to enable them to see podiatry as a profession that they would be proud to take part on? If by any chance you can find 2, 3, 4, 5, 6 or 7, that's even better, because actually what we need to do is create a supply line of podiatrists who come into the profession desperate to make a difference to people's lives. So my challenge to you is, we have a burning platform. We can put it out together, but we need to work together, absolutely in synergy together, to be able to make the impact that the populations need today and the populations need in the future. So if you could just Google whilst we're changing Inspiring the Future and just sign up, that would be great. And we can make available to you the advanced practice framework so that you can start to see those and be engaged in that work. So I wish you well, happy recruiting, and I look forward to an even bigger haul in 5 years' time, Chief Executive, so that we can actually have even more podiatrists of the ones that you've all pulled into the profession. Thank you very much.